Hi, I'm Summer Davis, part of the Lambda group. As we all know, COVID has brought many to evaluate their own mental health and how to cope with it, especially through isolation. My group's research question was, how have freshmen and sophomores' mental health at the University of Oregon been impacted by the pandemic? Multiple studies have been done on mental health through the duration of a pandemic, such as the CDC providing a survey after the pandemic calmed down, where it was found that the numbers of those that suffered with depression or anxiety experienced increased usage of substances and more stress-related symptoms, and including suicidal thoughts. Another study was done, and in the results, it was clear that subjects with mental illnesses, such as anxiety disorders, worried a lot more throughout the pandemic rather than those without a diagnosed anxiety disorder before the pandemic. And a COVID suspect group was seen to have more increased anxiety along with depression, sleep issues, and stress. Neuropsychiatric symptoms are also included apathy and aberrant motor efficiency, and this was seen especially in elderly people.
Hi, my name is Haley, and I will be explaining the methodology of our research project.
Hi, I'm Rachel. So to start off, we decided we wanted to stick to UVO students specifically because we knew that if we tried to gather data from a bunch of other schools, it wouldn't be the same because depending on what school you're at, COVID guidelines are different, and what state you live in, COVID is affecting people differently.
Because this research was to be done qualitatively, we used a survey distributed
Flyers all over campus, in the rec and in the dorms, in the dining halls, and we also posted it on our Instagram.
We used Google Forms because it was a simple and easy to use tool for us and our participants. Questions were a mix of checklists, multiple choice, and open-ended, which allowed us to obtain the qualitative data that we needed. Because we used a QR code placed in a variety of places around campus, as well as a link provided on our social media and in group chats, our sample was relatively random. We did not specifically pick out any groups, and therefore our method was simple random sampling. Our only specification was that participants were students at the University of Oregon who are members of the class of 2024 or 2025. We could not quite control who responded to our survey, so while we did get some responses not in this specific age group, we excluded that data so as to remain consistent. Overall, the sampling method served us well in providing ample data in regards to the mental health of college students during COVID-19.
Yeah, we were able to obtain about 46 responses from students, and we also provided some resources for students in case they're feeling any anxiety arise from the survey that they took. And we also made sure participants knew that this was completely anonymous and confidential, and they were also informed what the data was for.
Hi, my name is Jonathan. I'm going to be talking about our findings. Since the pandemic, our data shows that there has been an increase in anxiety, depression, and isolation. Thanks to our surveys, our participants have told us why there has been a negative effect on their mental health. For example, one of the topics that really increased the mental health for UL students was loss of friendship. This has created a greater feeling of isolation among friends, family, and peers.
Hi, my name is Francisco. I'm going to be talking about the limitations and advice for future scholars on this issue. We proved that it had a negative impact on mental health on the data we gathered. In this research, we had some limitations that kept us from getting more concrete data. One of the limitations we dealt with was time. We only had about 2 weeks to gather data on first and second year UO students. Not enough time for us to develop a well-planned plan to seek out what we were targeting. Secondly, the population size we wanted to acquire was not met because many UO students honestly couldn't care about surveys, as I see them avoiding those with clipboards on campus. Thirdly, our data was predominantly women, we would have at least liked the same equal ratio of male to woman ratio. Limitation of that was that we weren't able to distinguish which direction we wanted the survey to direct to. For future researchers wanting to revisit the experiment, I would recommend expanding on classes from like freshman to senior year. This would fix the population size problem and the equally sized gender populations.
Oh man, I'm super sad. Don't be sad. Why you sad?
From the pandemic.
Man,